Back in December of 2015, so now about 4 or 5 months ago, the acting administrator of CMS, the Center for Medicare and Medicaid Services, Andy Slavitt, was completing a series of visits around the country where he had been talking to physician leadership about what was going on with many different CMS initiatives. And he was coming up to Massachusetts, and his staff had asked us if we would help organize a group of leaders from academic medical centers, organized medicine, medical groups, and others to meet with the secretary. And we said, you know, we would be glad to do that, but we also thought it would be a good idea to have Mr. Slavitt get a sense of what it's actually like in a real doctor's office, having to deal with an EMR and all of the governmental requirements that go along with that. So what we did is we set up a meeting for Mr. Slavitt in the office of Dr. Leonard Finn. Lenny is a family physician who practices in Wellesley in a small 4-person office. And we brought Mr. Slavitt there and sat him down with Dr. Finn and some of his staff and kind of filled Mr. Slavitt in on what actually happens on an everyday basis in a doctor's office when they're trying to deal with an EMR and take care of patients at the same time. And I must say, I was incredibly impressed by Andy Slavitt. He is a smart guy. He asked a lot of probing questions. He understood what the issues were. I think he really gets it. So Lenny Finn took him into an exam room and sat in the doctor's chair and had Mr. Slavitt sit in a patient chair, and the computer was right in between them, and went through what it was like for a typical patient visit, what you had to document, what you had to do to make sure that you clicked all the right boxes for meaningful use, what you had to do to make sure data was ready to be extracted to do your PQRS report. And I think Mr. Slavitt walked away from that meeting with a different understanding of what it's like to actually be a physician practicing in today's environment while still trying to prioritize taking care of your patients. And very interestingly, maybe it was coincidence, maybe it wasn't, but just less than a month later, Mr. Slavitt was at a national healthcare conference out in California. And he declared, and I hope many of you have already heard or read this, but he declared at that meeting, quote, "The meaningful use program as it has existed will now be effectively over and replaced with something better." He went on to say, "We have got to get the hearts and minds of physicians back. I think we've lost them." Thank you for that, Kate. That was an incredible statement by the administrator of CMS, and I would like to think that the visit he had here had some impact on him. I'd like to thank Lenny Finn, who's sitting here right in the middle, for hosting us at his office that day. It was really an incredible meeting. So Mr. Slavitt has since said that the focus is going to shift from rewarding physicians for using EHRs to rewarding the outcomes that are achieved with our patients. He said that CMS was going to be dead serious about issues like interoperability and that they would not tolerate technology companies that refuse to share data with the platforms of their competitors. These are the kinds of issues that every one of you deal with every day when you're talking about interoperability, ability to share information, et cetera. CMS is going to get behind us on this. We weren't the only ones who were players on this issue. The AMA had been having lots of conversations with Mr. Slavitt and his staff at CMS, and they too deserve a lot of congratulation for the work that they did behind the scenes, helping all of us to help Mr. Slavitt get the point on this issue. Now, moving on from that, just within the last week, CMS has released its proposed Medicare payment formula rules. As you all know, SGR is dead, and we've moved on to MACRA. And MACRA is a pretty complex formula in and of itself. The proposed payment formula rules that came out are nearly 1,000 pages. You know, nothing's ever simple dealing with CMS. So we're just beginning to dig into this and to try and understand everything that's in there. Initial readings are that there are some positive takeaways here. There is a reduction in the burden of meaningful use, as I was just talking about. There's a limitation on the number of quality measures that can be used to kind of look at the quality of the work that we were doing and that we have to report on. Those things are a good start, but the devil, as they say, will lie in the details. There is a comment period that's open right now, and the Medical Society leadership and its staff will be working on commentary to make sure that our voices are heard loud and clear on this. But overall, I think that we're clearly in a better position on these issues than we were a year ago.